Good day, everyone. This video is all about the chapter 22 of our Organic Medicinal and Pharmaceutical Chemistry textbook, 11th edition. And this chapter is entitled Analgesic Agents. Hello, I am Clarissa Grace O'Heraldino, and together with my groupmates, Dindy Libunao and Tyra Dahim, we will try our best to explain to you the concept of this chapter. So, let us start. So in the screen, as you can see, we have a little game in here, and I hope you are familiar with the 4 picks, 1 word. So there are 4 pictures which depicts to only 1 word. So as you can see here, and here, and here. So let us try. If you can guess what is the 4-letter word that is being depicted by these 4 pictures. Okay? 5, 4, 3, 2, and 1. Okay, so time's up. I hope you all get it because it's actually easy. Diba? It's only just headache and backache and all kinds of ache. But the 4-letter word here, the correct answer would be pain. So in this little game that we have, I hope you have a background of what is analgesic agents in a nutshell. Okay, so to formally start our discussion about analgesic agents, let us first go back to the concept of pain. So why? Why do we need to discuss about pain? Because without pain, the analgesic agents would have not been obtained. Diba? Kasi kung hindi naman masakit, bakit kailangan pa ng medicine? Bakit kailangan pa ng drugs to relieve it? So pain is the most common complaint to which a patient seeks treatment. And this pain has a lot of classifications. It could be physiological, inflammatory, or neuropathic. Physiological is nociceptive, meaning it involves the senses. So example is touching a hot pot or getting yourself a cut, diba? So merong effect sa katawan, nasasaktan tayo. That is the physiological. Next, inflammatory. It could be infection or a tissue damage. Na common cause could be a bacterial or a virus. And next, it could be neuropathic pain, which is due to the injury of the peripheral or the central nervous system. So this originates from the limb amputation or maybe spinal surgery or viral infection. Pain again has these categories. It could be acute, chronic, cancer, arthropathy, visceral, neuropathic, and diabetic pain. And the 3 major classes of drugs used to manage those pains before are the opioids, non-steroidal, anti-inflammatory drugs or NSAIDs, and acetaminophen. But in 1970, the National Institute of Health, they formed a committee as requested by the president in order now to investigate therapies for rare diseases. But the initial focus of that committee was actually to manage pain. So because of the formation of this committee, they found out that the problem there was the lack of training of the physicians in the healthcare in pain management and their misconceptions about the use of the opioids and addiction. So pain before was not well managed because some doctors and physicians, they are scared to prescribe opioids medications kasi natakot sila for drug dependence or addiction ng patient. And Dahil na-found out nila na ang reason pala nito is because they don't have enough training and they still lack in knowledge about those medications, the opioids and the narcotics. So up until now, the problem continued through the end of the century. So even until now, we still have a problem with addiction, right? Kaya tayo may ginagawa ang government to counter to counteract those events. So kung maalala niyo oplantokan, ganyan. So this only means that analgesics are medicines that are prone to addiction or drug dependence, which was their problem before, and even up until now, gumawa tayo ng batas in order to manage the addiction. So now let's go on to the definition of the analgesics. Analgesic basically is a drug bringing about insensibility to pain without loss of consciousness. So unlike siya sa anesthesia na kapag in-administer sa katawan, mawawalan ka ng malay para hindi mo ramdam ng sakit. But in analgesic, it just bring about insensibility, kawalan ng sense ng pain without loss of consciousness. And according to Merriam-Webster, this drug is used to relieve pain and produce analgesia. Analgesia, yun na yung insensibility to pain. So there's these two terms, analgetic and analgesic. Analgetic and analgesic was interchanged, and it is believed that the etymologically correct term would be the analgetic. However, mas sikat na ginagamit ngayon itong term na analgesic. So, ito na ngayon ang ginagamit, analgesic, and analgetic is more on the medical term to describe if a drug has the analgesic effect or property. So, history of this analgesic agents. It is divided into 4 major eras. The first one is the period of discovery. This is the use of natural occurring plant drugs. So before na hindi pa siya napag-aralan, yung natural occurring or yung the pure compound here is being used. The second would be the isolation now of pure plant principles, for example, the alkaloids, from natural sources and their identification with analgesic action. This is the second. Meron ng study, meron ng isolation. The third one now is the development of organic chemistry and the first synthetic analgesics. So here, nag-improve na ang science and their study about the analgesics, and they now form a synthetic analgesic, a lab-made. And next era is the development of modern pharmacological techniques, making it possible to undertake a systematic testing of new analgesics. So we have a timeline here, ito, para mas madaling tandaan. So before, the earliest mention of analgesic is the opium poppy cultivation in 5000 BC for Common Era. So, matagal na masyado. The next thing here noted by the historians is the 1500 BC, where the Egypt uses the opium in their religious and medical purposes. Next is this it is in the early 1600s. It's Sydenham's laudanum is employed as pain reliever. So dito, meron ng ang Sydenham's laudanum is a combination of wine, alcohol, and opium. So dito, ginagamit nila siya as a pain reliever na. And Then now to the 1803, where the isolation of morphine is done by Friedrich Wilhelm Adam Turner, which is the morphine, the major psychoactive agent in opium. So, na-isolate na, doon na tayo sa parang uh, second era. Yeah, second. May isolation na. So, na-isolate yung morphine from the opium. Di ba opium yung ginagamit nila dito? So, na-isolate siya and na-found out na ang opium yung merong analgesic effect. In 1828, Waller introduced the third era indirectly with the synthesis of urea. And in 1886, salicylates were discovered, also acetanilide, phenacetin in 1887, and aspirin in 1899. And in 1992, the discovery of opioid receptors and other chemicals now. So the early discoveries were the principal contribution in this field until modern methods of pharmacological testing is now in use.
Hi, my name is Dini Dayan Chilibuna, and my report is all about morphine and related compounds. For the historical perspective of morphine, the discovery of morphine early in the 19th century and the demonstration of its potent analgesic properties led directly to the search for similar drugs from plant sources. It tribute to the remarkable potency and action of codeine and morphine, they have remained alone as outstanding and indispensable analgesics from a plant source. Only since 1938 have synthetic compounds rivaling morphine, yung mga equal or comparable siya ng mga compound sa morphine, in its action been found, although many earlier synthetic changes made on morphine itself gave more effective agents. Modifications of the morphine molecule are considered under the following headings. One is the early changes on morphine before the work of Small and Eddy and their co-workers. So the changes of morphine initiated in 1929 by Small, Eddy, and co-workers under the auspices or with the help of the Committee on Drug Addiction of the National Research Council and extending to the present time. Number 3, in 1938, Islev and Skoman reported the discovery that a simple piperidine derivative known as meperidine possessed analgesic activity. It was prepared as an antispasmodic, means it is a medication that relieves or prevents or treats symptoms such as tummy pain and muscle spasms, especially sa ating smooth muscles in the bowel wall. During the pharmacological testing of meperidine, in mice, it was observed to cause the peculiar erection of the tail known as the Strobe reaction. Yung pagtaas ng tail ng daga. This test has been used para malaman or to evaluate the effect of centrally acting muscle relaxants. It was also found that the replacement of the 4-phenyl group by hydrogen, alkyl, other aryl, aralkyl, and heterocyclic groups reduce analgesic activity. The placement of the phenyl and ester groups at the 4 position of 1-methylpiperidine. Next, we have here compounds related to meperidine. One is petidines for the relief of moderate to severe pain, including obstetric analgesia. Fluvoxamine is the treatment of obsessive compulsive disorder. It is a long-lasting in disorder sa mga tao na merong uncontrollable na thoughts or obsessions or podidin behaviors. We have properidine is an opiate analgesic and the isopropyl analog of meperidine. Fentanyl treat patients with severe pain or to manage pain after surgery. Going back sa headings, we have here the number 4, research initiated by Grewe in 1946 leading to the successful synthesis of the morphinan group of analgesics. He synthesized the tetracyclic compound that he first named morphan and then revised it to N-methylmorphinan. The N-methylmorphinan differs from the morphine lacking the ether bridge between C4 and C5. This compound possesses a high degree of analgesic activity, which suggests that the ether bridge is not essential. We have here compounds related to methadone. First is isomethadone. This is a synthetic opioid analgesic and antitussive. Methadone used for pain relief and treatment for drug addiction. Rizomoramide is an opioid analgesic and a racemic mixture, meaning my mixture of equal quantities of the substances dextromoramide. Lastly, we have beta-acetylmethanol used mainly in the treatment of narcotic dependence. Early morphine modifications. Morphine is obtained from opium. It is a narcotic drug and it is obtained from the unripe seed pods of the opium poppy, which is the Papaver somniferum. It is a plant of the family Papaveraceae. The pharmacological active principles of opium reside in its alkaloids. The most important, which is morphine, codeine, noscapine, which is the narcotine. Morphine, codeine, and tabane, which is mga opiate antagonists, yung mga oxycodone. These are acting upon the central nervous system and are analgesic, narcotic, and potentially addicting compounds. Papaverine and noscapine are the most. Other opium alkaloids act only to relax involuntary smooth muscles. There are two basic types of structures, phenanthrin, which is the morphine and codeine type, and the benzyl isoquinoline. The pharmacological actions of these two types are dissimilar. The morphine group acts principally on the CNS as a depressant and stimulant. The papaverine group naman nang mayroon lang siyang little effect on the nervous system but marked as antispasmodic. The depressant action of the morphine group is the most useful property, resulting in increased tolerance to pain, a sleepy feeling, lower perception of external stimuli, the feeling of well-being or euphoria. And then before 1929, the derivatives of morphine that were made primarily resulted from simple changes on the molecule, such as esterification of the phenolic and or alcoholic hydroxyl groups. The result of some compounds with greater activity than morphine but also with greater toxicity and addiction potential. For morphine-related compounds, first we have morphine hydrochloride. So it is prepared by neutralizing a hot aqueous suspension of morphine with diluted hydrochloric acid and then concentrating the resultant solution to crystallization. It is no longer commercially available. It occurs as silky, white, glistening needles or as white crystalline powder. The usual oral and subcutaneous dose is 15 milligrams every 4 hours as needed, with a suggested range of 8 to 20 milligrams. Morphine sulfate USP, it is prepared in the same manner as the hydrochloride, and it is neutralizing morphine with diluted sulfuric acid. It occurs as feathery, silky, white crystals as cubical masses of crystals or as white as crystalline powder. It is widely used in England and now in the United States by oral administration for the management of pain in cancer patients. Original use was for cough in tuberculosis patients. Morphine sulfate is available in variety of dosage forms, which is tablets, oral solution, parenteral, suppositories, and controlled release tablets and capsules. Codeine USP, it is an alkaloid that occurs naturally in opium. It occurs as levorotatory, means it has polarization of light. That is why it is light sensitive. It is also colorless, efflorescent crystals, and it is slightly soluble in water. 30 to 120 milligrams of codeine is considerably less efficient parenterally than 2 milligrams of morphine, and the usual side effects of morphine is respiratory depression, constipation, nausea, and such occur. Codeine has a reputation as an antitussive, depressing the cough reflex. It is one of the most widely used morphine-like analgesics. It is considerably less addicting than morphine. We have codeine phosphate USP. It is prepared by neutralizing codeine with phosphoric acid and precipitating the salt from aqueous solution with alcohol. Codeine occurs as fine, needle-shaped, white crystals or at white crystalline powder. It is also light sensitive and it is freely soluble in water. Solutions may be sterilized by boiling because of its high solubility in water. Compared with other sulfates, it is used to treat the symptoms of mild to moderately severe pain. For codeine sulfate USP, to prepare it, we need to neutralize an aqueous suspension of codeine with diluted sulfuric acid and then effecting crystallization. It occurs as white crystals, usually needle-like thin, or as a white crystalline powder and also light sensitive. It is soluble in water, much less soluble in alcohol, and insoluble in ether or chloroform. Codeine sulfate is an opioid analgesic indicated for the relief of mild to moderately severe pain, where the use of an opioid analgesic is appropriate. Diacetyl morphine hydrochloride, it is prescribed to treat severe pain. It is very addictive and illegal siya sa United States. Diacetyl morphine hydrochloride binds to opioid receptors in the central nervous system. Then we have hydromorphone. It is a synthetic derivative of morphine. It is slightly soluble in water, freely soluble in alcohol, and very soluble in chloroform. It is a German origin and was introduced in 1926. It is a substitute for morphine 5 times as potent. It is less daytime sedation or drowsiness. It is a potent antitussive and para din siya sa mga coughs that are difficult to control. Hydromorphone hydrochloride USP, it is light sensitive, white crystalline powder that is freely soluble in water, sparingly soluble in alcohol, and practically insoluble in ether. It is available in tablet form, liquid, parenteral, and suppository dosage forms. The dose is to 1 to 8 milligrams. Hydrocodone bitartrate USP. It is prepared by catalytic rearrangement of codeine or pag-hydrolyze ng dihydrotabane. It occurs as fine white crystals or as white crystalline powder. It is soluble in water, slightly soluble in alcohol, and insoluble in ether. It forms as acidic solutions and it is affected by light. Advantage is that it has lower frequency of side effects. It is also para sa ubo and it used primarily for this purpose. It is on the market in many cough preparations as well as in tablet and parenteral forms. Then we have oxymorphone hydrochloride USP. It is introduced in 1959, used as the hydrochloride salt which occurs as white crystalline powder, freely soluble in water and sparingly soluble in alcohol. Oxymorphone is as effective as morphine in 1/8 to 1/10 the dosage, with good duration and slightly lower frequency of side effects. Sa pagkontrol pa ng postoperative pain, maybe acute pain ba yan or chronic pain, and pain of advanced neoplastic diseases, yung may abnormal growth of cells, also known as yung mga tumors, and other types of pain, not be used for relief of minor pains and not used as cough suppressant. Pwede din siya ma-administer orally, parenterally, intravenously, intramuscularly, subcutaneously, or rectally, and for these purposes is supplied as a solution for injection for 1.0 and 1.5 milligrams of milliliters, and in suppositories is for 5 milligrams. Next, we have nalbuphine hydrochloride. It was introduced in 1979 as a pulse analgesic of the agonist-antagonist type. It occurs a white to off-white crystalline powder that is soluble in water and sparingly soluble in alcohol. This analgesic shows a very rapid onset with a durative action up to 6 hours. Marketed as an injectable 10 and 20 milligrams of milliliters, the usual dose is 10 milligrams administered subcutaneously. It can be intramuscularly or intravenously at 3 to 6 hour intervals with a maximal daily dose of 160 milligrams. Oxycodone hydrochloride, this derivative of morphine occurs as a white crystalline powder that is soluble in water. Although this drug is almost as likely to cause addiction as morphine, it is sold in the United States, several other products in combination with aspirin or acetaminophen. Ginagamit din siya as sedative, an analgesic, and a narcotic to depress the cough reflex. It is used in 3 to 5 milligrams doses, and as an analgesic is to 5 to 10 milligram doses. For severe pain naman, dose of 20 milligrams is given subcutaneously. And kung balaan nyo tong Netflix documentary bala about sa pharmacist, itong OxyContin, it is a type of pain drug and brand name ni siya. The documentary talks about yung kanilang opioid epidemic na some teenagers nang ginayuse nila to ning OxyContin for recreational use. That's why it's very popular sa ila that time, lalo na sa mga drug users and addicts. By crushing the tablets and dissolve the contents to inject the mixture, and several overdose deaths have from this practice. Dihydrocodeine bitartrate. Bitartrate salt occurs as white crystals that are soluble in water and only slightly soluble in alcohol. Subcutaneously, a dose of 30 milligrams of this drug is almost equivalent to 10 milligrams of morphine as an analgesic. It has faster onset and negligible side effects. Normorphine naman, it is an analgesic effects that are nearly equal by the intraventricular route, and wala siya may ginapakita nga sedative effects of morphine sa single doses but does so cumulatively. It was once considered for possible use in the treatment of narcotic addiction, but it has no current use. Then we have tramadol hydrochloride. This drug possesses opioid activity but has other analgesic activity that is not reversed by naloxone. It produces significantly lower morphine-like side effects. It is available in tablet form for the use in moderate to severe pain in a dose of 50 to 100 milligrams every 4 to 6 hours, and in combination 37.5 milligrams with acetaminophen or Orthoset for short-term management of acute pain. Pag si morphine hydrochloride is heated at 140 degrees under pressure with strong 35% hydrochloric acid, then it loses a molecular water and yields a compound known as apomorphine. Apomorphine hydrochloride USP, it is odorless and occurs as glistening white or grayish-white crystals or as white. It is light sensitive and turns green on pag na-expose siya sa air and light. It is administered subcutaneously to obtain emesis, which means vomiting due to the contractions of the gut and the muscles. It is ineffective orally. That is why nga kailangan i-administered siya under the skin subcutaneously. And then, apomorphine is one of the most effective prompt to 10 to 15 minutes and safe emetics in use today. It is classified as an orphan drug for the use in Parkinson's disease. Then we have alpha-pyridine hydrochloride USP, prepared by the method of Zering and Lee, occurs as a white crystalline powder that is freely soluble in water, alcohol, and chloroform, but insoluble in ether. It appears to be quite safe for the use in this capacity, causing little or no respiratory depression in either mother or fetus. For anilridine USP, it occurs as a white to yellowish white crystalline powder that is freely soluble in alcohol but only very slightly soluble in water. It is oxidized on exposure to air and light. The injection is prepared by dissolving the free base in phosphoric acid solution, synthetic opioid, and strong analgesic medication. Loperamide hydrochloride USP. It is a hybrid of a methadone-like meperidine molecule. It acts as an antidiarrheal, which means by slowing down the movement of the gut and decreases the number of bowel movement. Loperamide is available as 2 milligrams for treatment of acute and chronic diarrhea. Recommended dosage is 4 milligrams initially, with 2 milligrams after each stool for a maximum of 16 milligrams per day. Fentanyl citrate USP, a crystalline powder soluble in water and a methanol sparingly soluble in chloroform, has an analgesic activity 50 times that of morphine in humans. It is rapid onset with a duration of 4 minutes, primarily used as an adjunct to anesthesia for the use as neuroleptalgia in surgery. Metotrimiprazine USP, it is a phenothiazine derivative closely related to chlorampramazine, possesses a strong analgesic activity. An intramuscular dose of 15 to 20 milligrams is equal to 10 milligrams of morphine in humans. This often results in dizziness and fainting, limiting the use of methotrexate to non-ambulatory patients. It should be used with caution along with antihypertensives and other sedatives. It shows some advantage in patients for whom addiction and respiratory depressions are problems. Levolorphan tartrate USP, it occurs as a white or practically white odorless crystalline powder. It is soluble in water, sparingly soluble in alcohol, and practically insoluble in chloroform and ether. Nag-resemble sila ng nalorphine, which is sa kanilang pharmacological action and is about 5 times more effective as a narcotic antagonist. It prevents the respiratory depression usually associated with these drugs, and it is no longer marketed. For narcotic antagonists, naloxone hydrochloride USP, presently on the market as the agent of choice for treating narcotic overdose, 7 times more active than nalorphine in antagonizing the effects of morphine. It shows no withdrawal effects after long-term administration, and duration of action is about 4 hours. For this treatment, heroin addiction with adequate doses of naloxone, the addict does not receive any effect from the heroin. It is given to an addict only after a detoxification period. Its long-term usefulness is currently limited because of its short duration of action requires large oral doses. Naltrexone, it is the preferred agent for treating former opiate addicts. Oral doses of 50 milligrams every day or 100 milligrams 3 times weekly to block or protect a patient from the effects of heroin. It is available as 50 milligrams tablets for the use in treating narcotic addiction. It has also shown promise for suppressing craving in the treatment of alcoholism and is available for that use. Nalmefene hydrochloride, it is the latest pure antagonist to be introduced for the use in reversing the effects of opioid agonists. It is longer acting than naltrexone and is used for the same indications. It is available as injection 0.1 and 1.0 milligrams milliliters. Ginagamit din siya for treating narcotic addiction and the treatment of alcoholism. And lastly, we have for narcotic antagonist is cyclazoxine. It is not been marketed, yet it is a potent narcotic antagonist that has shown analgesic activity in humans in 1 milligram doses. It does possess hallucinogenic side effects at higher doses, which limited its usefulness as an analgesic. It was studied like naloxone in the treatment of narcotic addiction. Voluntary treatment with cyclazoxine deprives addicts of the euphorogenic effects of heroin. Its dependence liability is lower, and the effects of withdrawal develop more slowly and are milder.
Now let us move on to the anti-inflammatory analgesics. Basically, anti-inflammatory analgesics talks about the pain reliever medication that reduces inflammation, kaya nga anti-inflammatory kasi pinipigilan niya, inhibit na ang inflammation at the site of the pain. So the early growth of this anti-inflammatory analgesic was actually related to fever. So as we all know, fever is the natural defense of the body in which tinataas niya ang temperature in an attempt to kill the causative agent by means of denaturation, right? But then, so akala nila before na kapag nababaan na nila yung fever, kapag na-lower down nila yung lagnat, uh, gagaling na yung patient and that would be the end of the pain. However, na-realize nila that lowering or curing fever is not the end of it. They have observed that fever is an outward symptom only. So parang after effect lang siya nung naging real source ng sakit ng patient. So they have hypothesized that maybe there is some more fundamental ailment that which caused the fever to occur. So because of that, since 'di ba dati nga fever yung focus, so sikat yung mga antipyretics na medication. However, yung na-realize nila na parang hindi enough, na pinababa lang yung lagnat, doon doon nag-spring out yung analgesics and more specifically the anti-inflammatory analgesics. However, meron pa rin namang antipyretics that they have observed to have excellent analgesics for minor aches and pains. So, one of those drugs, those drugs are still actually used up until now as they were found out na may analgesic effects sila. And now, on this present time, they are more used because of their analgesic property, mainly in the symptomatic treatment of rheumatic fever, rheumatoid arthritis, osteoarthritis. So yun, an example of that is the salicylates and the corticosteroids. Salicylates is used to treat fever, pain, and inflammation, and the reduction of inflammatory effects of rheumatic fever was recognized. And corticosteroids, from the steroids, which is steroids are actually naturally occurring in the body. Pero meron ding steroids naman with, one of those is corticosteroids and the other one is anabolic. So itong corticosteroids, they're the medicines that quickly fight inflammation in the body. However, merong naging issue noon na these drugs should not be called analgesic dahil may properties sila na parang hindi align sa analgesic na tinatawag na medications. So with that, there is the term antalgics by Ferno. And antalgics is the designated category name for anti-inflammatory analgesics, but they are distinctive from the narcotics. Kasi there were two principal features that were mentioned. First nga, kasi they are low activity. They exhibit low activity for a given dose. And second, they lack the addiction potential. So as I mentioned earlier na ang opioids or yung mga early discovered analgesics in their natural pure form, they have addictive property. Kaya nga hindi sila nagpe-prescribe ng mga physicians kasi wala pa masyadong pag-aaral and they were scared na ang pasyente ay ma-addict kasi na-observe nila na maraming taong na-addict din sa opioids. And that's why one of the most problematic siya na gamot before. Kasi wala siyang cure and at the same time kapag abrupt siyang tinigil, gagawin siya ng mas malalang side effect. So going back, yun nga, they have created this term antalgics. So with the present na ginagamit nung time na yun, yung salicylates and corticosteroids, they have identified the long-term use of it has a side effect or mas harmful pa yung ina-elicit sila ng effect. So because of that, The research intensified their endeavor in an effort to find a non-steroidal anti-inflammatory drugs or what we know as NSAIDs. And because of that, hindi naman sila nabigo, although limited pa yung knowledge nila and limited yung knowledge nila about the causes and mechanisms of inflammatory disease, pero meron pa rin silang nahanap or na-find out. So one of those is the aspirin, the mostly used drugs, and it says to have a protection against, it protects against myocardial infarctions. And the next one is the indomethacin. Both of them inhibits the prostaglandin synthesis in several tissues. So itong prostaglandin synthesis kasi one of the process na kung saan nag-i-initiate siya ng inflammation. So ang ginagawa ng dalawang medicine na na-discover is to inhibit those processes. So even with the substantial advancement in the identification of new and more selective NSAIDs, their capacity to treat all pain has a ceiling impact. The combinations of opioid medications and NSAIDs are increasingly being used to treat severe and persistent pain. So, yun nga, nung time na to, hindi pa masyadong pinapag-aralan or kulang pa yung knowledge and studies about that. So, that is why may limitations pa rin sa paggamit nun. Kaya, they wanted to find non-steroidal anti-inflammatory drugs na kung saan mag-inhibit siya ng specific na receptor. So, as I mentioned earlier, yung prostaglandin synthase, ang ini-inhibit niya is yung enzyme na mas tinatawag na ngayon na cyclooxygenase, which has two forms, the cyclooxygenase 1 and cyclooxygenase 2. And the cyclooxygenase 1 or COX-1 plays role in the production of essential prostaglandins. Yung COX-2 naman is responsible for the response of several pro-inflammatory mediators. So even if na dalawa yung hinahanap sa COX-1 and COX-2, mas more specific yung COX-2 inhibitors. So that's why in-expand pa nila yung research nila. So now let's go to the derivatives. First one is the salicylic acid derivatives. So in 1827, salicylene was isolated by this scientist Leroux in 1827. Salicylene is the salicylic acid that contains glycoside. In 1838, Perea prepared the salicylic acid. In 1844, Cahors obtained the salicylic acid from the oil of wintergreen or the methyl salicylate. In 1860 naman, Colby and Lellerman now prepared the synthetically prepared salicylic acid synthetically from phenol. And Boss in 1875 introduced the sodium salicylate. Nankey in 1886 now introduced the phenyl salicylate to the public. And the first one to prepare the aspirin was Gerard in 1853. But hindi pa rin siya masyadong kilala until na-discover ni Felix Hoffman yung kanyang pharmacological activities. And in 1899, the salicylic acid, the aspirin rather, was tested and introduced it into the medicine by Dresser. And hindi pa siya aspirin before, salicylic acid pa lang siya, ganyan. But aspirin was taken from A in the acetyl and added ng spirin from the old name of salicylic or spirit acid from its natural source, the spirea plants. So, ito yung parang brief na naging history ng salicylic acid. Moving on for its pharmacology, the salicylates and related compounds exerts its antipyretic action by increasing heat elimination of the body via mobilization of water and consequent pollution, meaning sweating without and causing cutaneous irritation. The antipyretic and analgesic actions are believed to work by inhibiting the cyclooxygenase, the one that I mentioned earlier, and reducing the levels of prostaglandin E2 and tosnimal. Itong prostaglandin E2 is a mediator of the febrile response. Meaning, isa siya sa mga nag-exert ng fever in the hypothalamic area of the brain that regulates body temperature. So, salicylate acid, from the word acid, is acidic in nature and are readily absorbed from the stomach and the small intestine. However, their absorption depends strongly on the pH of the environment. So, kapag meron siyang antacid or buffer, mahirapan ng katawan na i-absorb siya. However, may studies naman na kapag nasa right concentration lang yung buffer, mas mapapabilis din yung absorption niya. In the form of calcium and buffered aspirin. Yan. So now, discuss po natin yung type 1 na compounds. So, salicylic acid actually has two types. Itong una, and ito yung type 2. Ang pinagkaiba nila is the type 1 represents those that are formed by modifying the carboxyl group. So, kung ito yung salicylic acid at ito yung carboxyl group. Kapag dito ang modification niya, type 1 siya. Pag ang modification naman is the substitution of the hydroxyl group, ito hydroxyl ito, of the salicylic acid, then type 2 siya, like this one. Nandito yung R. So, ito yung pwedeng ma-modify. Yan, R. Type 2A, kung dito lang, if may substitution ng mga hydroxyl. Type 2B, pag may addition siya ng oxygen. And bakit ba may derivatives or bakit ba may na-modify? It is because that in an attempt to prevent the gastric symptom and the undesirable taste inherent with the common salicylic acid. So, di ba acidic yung salicylic acid? So, meron siyang tendency na mag-cause siya ng irritation in the stomach. So, kaya siya ginagawa ng modification kasi yung structure niya is may effect sa kung ano ang activity na may elicit niya. So, doon tayo sa compounds of the type 1. So, ang masasubstitute dun is yung alkyl and aryl esters, which are used externally as counter-irritants or could be internally for inorganic salicylates. The first one here we have is the sodium salicylate USP. So, this is soluble in water, alcohol, and glycerin with this ratio. And it is so pinkish in tinge or white methylcrystalline powder. It has a faint characteristic odor and a sweet saline taste. And it is affected by light as well. So this forms a eutectic mixture with the antipyrine and produces a violet coloration with iron or salts. Thus, it should be avoided to be interact with. And the solutions of the compound must be neutral or slightly basic in order to prevent it from precipitation of free salicylic acid. The USP salt forms or neutral or acid solution. So, ang USP, kasi USP ito, no? Ang salt forms niya is neutral despite na ang sabi natin kanina is yung salicylic acid is acidic in nature. This is because na siya, na-formulate na siya. Di ba, may ratio tayo kanina. Na-formulate na siya. 1 mole of salicylic acid and sodium bicarbonate. And the use of sodium bicarbonate here is to decrease the counteract the acidic nature. Kaya siya nagiging neutral. And it is administered with enteric-coated tablets para malasin yung gastric distress. So yun nga, yung use ng bicarbonate decrease plasma levels and increase the excretion of the free salicylate in urine. So ito yung structure ng sodium salicylate USP. Next, we have sodium thiosalicylate or rexylate. It is the sulfur or thio analog of the sodium salicylate. So, ang pinagkaiba lang meron siyang thiol group, diba? Yung SH. And it is recommended for gout, rheumatic fever, muscular pains, and in doses of 150 milligrams every every 6 hours for 2 days. Okay, sorry, typo. And once a day, 1 milligram once or twice daily. And it is only available for intravenous or injection. And ito yung ulit yung structural formula niya. Next is the magnesium salicylate USP or mobidin magan. This is a sodium 3 salicylate preparation for use when sodium intake is restricted. So, ito diba sa sodium thiosalicylate for the gout and rheumatic fever and muscular pain. So, ever if ang patient is parang mataas yung sodium levels na so nare-restrict. So, another option would be the magnesium salicylate USP. And it's claimed to produce less gastrointestinal upset, and the dosage indication is the same as the sodium salicylate. So, ito naman yung kanyang structural formula. Magkaiba sila, no? Kasi ito, isa lang yung ring, then may tayo. Ito naman sa magnesium sulfate, walang tayo group. Meron siyang magnesium. Okay, next. Now we have the choline salicylate or artrophat. And this is extremely soluble in water and available as flavored liquid. It is claimed to absorb more rapidly than aspirin, giving a faster peak blood levels. It is used when salicylates are indicated in a recommended dose of 870 milligrams to 1.74 grams daily. It is available in combination with magnesium salicylate. So, ito pang paramihan na naman na intake. And this is the structural formula of choline salicylate. So, there are also other salicylic acid derivatives in which wala naman sila masyadong use or more advantage than the mentioned derivatives. So, they are ammonium lithium, strontium salts, of salicylic acid. So we have here is Salol principle. In this concept here is there are two toxic substances that were combined into an ester and taken internally slowly to hydrolyze in the intestine and to give antiseptic action of its components. So, ang two toxic substances would be phenol and salicylate. If these toxic substances were active, it is called full solol or true solol. Example is the miracle benzoate, beta-noctyl benzoate, solol. And kung hindi naman, kung isa is toxic, ang isa is active, ang tawag sa kanya is partial solol. Examples are here. And although many solol-type compounds have been prepared and used to some extent, none of is presently valuable in therapeutics, and all are surpassed by other agents. So medyo hindi na rin siya masyadong in use in compare sa nabanggit kanina. Next, we have the phenyl salicylate. Here in na white crystalline siya powder, taste and has a taste and odor faint. It is insoluble in water and slightly soluble in glycerin, in alcohol, and etc. And this is mainly used in intercoating for tablets and capsules. However, hindi siya ganun ka-efficient na intercoating material, pero pwede pa rin siya as a superseded by others. And is also used as a sun filter ointment for sunburn prevention. Ito ang kanyang structural formula. Salicylamide is diapaquine o hydroxy benzamide. Benzamide is a derivative of salicylic acid and is readily prepared from salicyl chloride and ammonia. So, ang ano naman ito, use is it has analgesic and antipyretic activity, but is probably no greater than the aspirin. However, useful siya for the patients that has a sensitivity to salicylates. So, ito kanyang structural formula. So, now we have this aspirin, the aspirin. The hydrogen atom of the hydroxyl group in salicylic acid is replaced by the acetyl group. This is also may be accomplished by using acetyl chloride with salicylic acid or ketamine with salicylic acid. So aspirin occurs is white crystalline powder. So if you could observe now, mostly the salicylic acid has para-parasang physical nila na itsura, white crystalline powder. So it's like dissolvable in water, alcohol, chloroform, ether, but easily dissolved in glycerin. So aspirin is acidic and produces effervescence or bubbles for the release of the carbon dioxide in the presence of iodides, and it slowly liberates in iodine. So there is a recommended dose for infants called baby aspirin. And for those also with low cardiovascular risk, meron low dose din yung binibigay. So here, sinasabi na there are studies that NSAIDs and aspirin should be taken together because the NSAIDs could interfere with the aspirin's cardiovascular benefits. So if ever, i-take note siya na hindi siya pwede ipagsubay sa NSAIDs if the purpose of the aspirin is for the cardiovascular benefits. They should not be taken within 12 hours of each other. Aspirin is mainly used for its antipyretic, analgesic, and anti-rheumatic activity, and usually in powder, capsule, suppository, or in tablet form. So next is salicylate. Salicylic acid or salicylic acid, full name. Or brand name is Analgesic and disalcid. This is the ester form between the two salicylic acid molecules to which it is hydrolyzed following the absorption. So it is reportedly to cause less gastric upset than the aspirin because it is insoluble in stomach not until it reaches the small intestine. It also has limited clinical suggest, also has as effective as aspirin and may have fewer side effects. So the recommended dose is 325 milligrams 2 to 3 times a day, but it is only available with prescription, RX only. And this is the structural formula. So next is diflunisal. This is one of the 700 analogs of aspirin, and that is said to be made more potent. So it has no longer and less gastric irritation. It is because of the introduction of the hydrophobic group in the fifth position. So it also tested in animals found that at least 4 times more potent, and in humans twice as effective. So it is marketed in tablets as treatment for mild to moderate pain of rheumatoid arthritis and osteoarthritis. And the clinical structural formula is this one. Yung nakabilang. So now let us move on to the N-arylantranilic derivatives. To continue with the N-arylantranilic derivatives, we have first here the mefenamic acid, which is, I think, common siya sa atin, diba? Kasi marinig natin pag masakit ang ngipin or what, pinapabila din ng mefenamic acid, which is because mefenamic acid is an analgesic. So it occurs of white crystalline powder and insoluble in water and slightly soluble in alcohol. And its analgesic property was discovered ever since aminopyrine. And the mechanism of this analgesic action is believed to be related to its ability to block prostaglandin synthetase. So, di ba kanina, yun din yung hinahanap natin for the non-steroidal anti-inflammatory drugs to inhibit the prostaglandin synthase, which would result in fever. So, ang dose niya dito is 250, but meron din 600 milligram. Ang dose na 250 niya is as equals 600 milligram ng aspirin para exert ang analgesic property. So, meaning, mas increase yung kanyang efficacy. However, ang side effects niya could be diarrhea, drowsiness, and headache. Also, the possibility of blood disorders has prompted its limitation. So, meron siyang limitation na 7 days lang kasi baka further kapag take pa niyan is magkakaroon ka na ng blood disorders. So, it is not recommended for children or for pregnancy for mothers, but it has been approved for management of primary dysmenorrhea. Because the primary dysmenorrhea is thought to be caused by excessive concentrations of prostaglandins and endoperoxides. So this is the structural formula of mefenamic acid. Next is the meclofenamate sodium. So this medicine is for the treatment of acute and chronic rheumatoid arthritis. but it has its side effect that is gastrointestinal, which is what we call diarrhea. And ito ang kanyang structural formula. So next derivative is the arylacetic acid. The first one we have here is the indomethacin USP. So this indomethacin USP is widely used as an anti-inflammatory analgesic for rheumatoid arthritis, spondylitis, and osteoarthritis, and also lesser extent in gout. But it is also accompanied by its side effects such as gastric distress and headache. Also been associated with peptic ulceration, blood disorders, and also death. So, although ganun yung mga side effects niya, it was observed that it is related to the dosage of the drug. So, ma-minimize siya if matama yung calculation ng pag-administer ng indomethacin USP. So this medicine is recommended for patients who cannot tolerate aspirin and in place of the phenylbutazone in the long-term therapy because they are less hazardous than those the corticosteroids. So ito, structural formula ng indomethacin USP. Next here we have the Slindoc USP. And this is recommended again for rheumatoid arthritis, osteoarthritis, and ankylosing spondylitis with a dose of 150 to 200 milligrams twice daily. So it is mahaba yung ano na, ayupak na yun, V5-toro-2 methyl 1-methyl-sulfonylurenol 1-HMDN3 acetic acid, or the brand name is Clinoril. So ito yung kanyang structural formula. Next is the palmitin sodium USP, and its mechanism of action is again to inhibit the prostaglandin synthesis and lowers the PEG blood levels. So ang brand name is Galectin. This is the arylacetic acid derivative with a pyrrole in the aryl group. And the available dosage form is tablet with 200 and 600 milligrams and also capsule. And ito ang kanyang structural formula. Next is ibuprofen USP, commonly known as Motrin, Advil, Nuprim, or dito sa Philippines, Medicol. And it appears to be comparable to aspirin in the treatment of rheumatoid arthritis with lower incidence of side of compounds. The potency was enhanced in the ibuprofen with the introduction of alpha metal group of the acetic acid molecule. And the precursor ibufenoc was abandoned owing to the hepatotoxicity. So yung ibufenoc is less potent siya. So kaya siya synthesize pa. And the activity resides with the S isomer, not only for ibuprofen but throughout the arylacetic acid series. So they are inhibitors of the prostaglandin synthetase, and recommend dosage is 400 milligram, pero meron siyang yung over-the-counter yung nabibili natin, which is 200 milligrams. Mostly kasi sa mga over-the-counters, kaya siya magiging RX only because yung higher dosage niya, yun na yung makakos ng adverse effect if hindi siya na-take as prescribed. And ito yung kanyang structural formula for the ibuprofen. Next is naproxen USP. occurs as white to off-white then and sparingly soluble in acidic solutions, but freely soluble in alkaline and highly soluble in organic or lipid-like solutions. So this is also recommended for rheumatoid and gouty arthritis. And this is the structural formula for naproxen USP. Next, we have phenylprofen calcium USP. And this is recommended again for rheumatoid arthritis, osteoarthritis, and divided in 4 doses as it is taken 4 times daily or a day with a maximum of 3,200 milligrams per day. And it should be taken at least 30 minutes before or 2 hours after meals for pain relief with a 400 milligram na dosage na equivalent sa 650 milligram ng aspirin. And ito kaya structural formula ng calcium na gulupong sa dalawang benzene na dalawa. Ayan. Salicylic acid structure. Next, we have ketoprofen USP. So this has a low incidence of side effects and has been approved for the over-the-counter sales. It is available as capsules and tablets, 25 to 50 milligrams, with the recommended daily dose of 300 milligrams divided into 3 or 4 doses. And also available for extended release capsules. So ito naman yung kanyang structural formula. Next is the terbiprofen USP. It is another hydrotropic acid analog that is used in acute or long-term management for the rheumatoid arthritis and osteoarthritis. Available in tablets with a recommended dose of 200 to 300 milligrams divided into 2, 3, or 4 times daily. And ito yung terbiprofen na structural formula. Next, we have the diclofenac potassium and diclofenac sodium. So this is indicated for short and long-term treatment of rheumatoid arthritis and osteoarthritis, and also ankylosing spondylitis. The potassium salt or the cataflam is faster acting, indicated for the management of the acute pain and primary dysmenorrhea. The sodium salt, on the other hand, is available as delayed release tablets, and they are divided in doses 1 to 2 times. The potassium salt is available as tablet naman 15 milligrams with a recommended dose of 50 milligrams na 3 times daily. So ito yung sa diclofenac potassium with the K plus. Ito yung sa sodium yung Na. Next is the nabumetone or relafen. This serves as depot drug to its active metabolite 6-methoxy-2-naphthylacetic acid. And like other lactic acid drugs, it is used for short-term or long-term management of the rheumatoid arthritis and osteoarthritis. Ito ang kanyang structural formula. Next, we have ketorolac tromethamine. Ketorolac tromethamine is indicated for the treatment of moderate to severe acute pain. And because of this, meron siyang number of potential side effects, hindi dapat siya taas ang pag-take nito sa 5 days. So 5 days yung limit. And treatment is usually initiated intravenously or intramuscularly. with analgesia maintained by initial doses of 20 to 30 milligrams followed by 10 milligrams every 4 to 6 hours. And ito yung kanyang structural formula. Next, etodolac or lodin possesses the indole ring as the aryl portion of this group of NSAID drugs. It shares many properties and indicated for short and long-term management of pain and osteoarthritis. So, available siya as capsules and tablets and extended release. Ito kanyang structural formula. Next is the oxaprozine or Daypro. It differs from other members because it is a real propanoic acid derivative, but it shares the same properties and side effects. It is indicated again for the short and long-term management of osteoarthritis and rheumatoid arthritis. Ito ang kanyang structural formula, oxaprozine. Next, we have piroxicam USP. This represents a class of acidic inhibitors of prostaglandin synthetase, but it does not antagonize the PGT. This drug is strong-acting with a plasma half-life of 50 hours. Thus, the dose required is 30 to 30 milligrams once only daily. So, ang 35 milligrams niya is reported to be similar to the 400 milligrams of ang recommended dosage niya na 20 to 30 is similar to the 25 milligrams ng indomethacin or the 400 milligrams ng ibuprofen. And piroxicam structural formula is this one. Next, we have meloxicam. This is alike din ng piroxicam in structure. Diba? May S din siya, may sulfur din siya. Ayan. Meron lang siyang pagkakaiba dito na part na may nitrogen siya dito. Ayan. So, this is indicated for the use of osteoarthritis and has relatively longer half-life of 15 to 20 hours. Meloxicam. So then last three for the arylacetic acid derivatives, we have the selecosib, rofecoxib, and valdecoxib. So selecosib, ito siya yung first COX-2 inhibitor or cyclooxygenase inhibitor sa type 2. So type 2, and it was the first one to be marketed with the brand name Celebrex. It has been approved for the use of rheumatoid arthritis and osteoarthritis. Also approved for the reducing number of adenomatous colorectal polyps in familiar adenomatous polyposis or FAP. So ito yung kanyang structure formula. For the rofecoxib naman, COX-2 inhibitor din siya with greater potency and longer half-life than the selecosib. It is approved for osteoarthritis, acute pain, primary dysmenorrhea with a dose of 12.5 milligrams a day and a maximum of 25 milligrams a day for osteoarthritis. And has the recommended maximum administration of 5 days for acute pain and primary dysmenorrhea. Rofecoxib, ito yung kanyang structural formula. And last, valdecoxib, another COX-2 inhibitor, and approved the same as the uses the same as the selecosib and rofecoxib. Recommended dose nilang 10 milligrams for the rheumatoid arthritis and osteoarthritis and 40 milligrams naman for primary dysmenorrhea. Several other COX-2 enzyme inhibitors are under investigation, and there are also clinical trials that has been done in order to highly specific the celecoxib and the parental paracoxib. So this is for the relaxative acid derivatives. Next is for the aniline and p-aminophenol derivatives. We have here the acetaminophen, USP. So acetaminophen, if you're familiar, is also a antipyretic drug. So an acetyl p-aminophenol for hydroxy acetamylide or APAP in short. Ito na yung APAP na mas commonly known. It has analgesic and antipyretic comparable to those acetamylate and is used in the same condition. It exerts its effect by inhibiting the cyclooxygenase enzyme centrally but has a little effect peripherally. Meron siyang precautions that should not exceed with the recommended dosage and also has the risk of liver toxicity in chronic kapag na-abuse siya or na-overdose. Meron siyang liver toxicity. Same as with the paracetamol. And it is also available as non-prescription forms. Next, we have the pyrazolones and pyrazolidinedione derivatives. And again, pyrazolones and pyrazolidinedione derivatives. And we have here the antipyrine. The antipyrine USP is the only medication that is listed under these derivatives. No? So this is the last of the anti-inflammatory drugs, analgesics. So this is the first important drugs to be made in 1887 synthetically. It is soluble in water or chloroform and less in ether. Locally, it exerts its paralytic action on the sensory and motor nerves, resulting in some anesthesia and vasoconstriction, but exerts a feeble antiseptic effect. Systematically, it causes results that are similar to those acetamylate, although they are usually more rapid. It is readily absorbed after the oral administration, and it circulates freely and is excreted chiefly by the kidneys without having been changed chemically. So antipyrine USP has this chemical structural formula. So that's it. That's the end of the anti-inflammatory analgesics. And I believe I am also the last reporter. So thank you so much for listening. And I hope you have learned a lot in the analgesic agents, which are the painkillers of the drug process. Thank you for listening and have a great day.